Good morning, SSS. Today, Group 9 will be presenting Nurse Theories and the Theory, which is Betty Newman's nursing theory.
Now, I would like to briefly walk you through the remarkable life and contributions of Betty Newman, a visionary nurse theorist best known for the Newman systems model. She was born on September 11, 1994 in Lowell, Ohio, and grew up on a farm. During World War II, she worked as an aircraft instruments technician, a rare role for women at that time. In 1947, she earned her nursing diploma from People Hospital Schools of Nursing in Akron, Ohio. By 1957, she completed her bachelor's degree in public health and psychology from Universities of California, Los Angeles, and later received her master's in mental health and public health in 1966, also from UCLA. Between 1967 and 1973, she began formulating the Nueman Systems model as a teaching tool and developed the first community mental health program for graduate students in Los Angeles. This model has since influenced nursing theory worldwide. In 1982, she published the foundational book, The Nueman Systems Model Applications to Nursing Education and Practice. She then went on to earn a doctorate in clinical psychology in 1985. In 1988, she founded the Nueman Systems Model Trustees Group, Incorporated, to protect the integrity of her work and remains actively involved until 2009. Sadly, Betty Newman passed away in 2022 at the age of 97, leaving behind a legacy of innovation, education, and advocacy in holistic nursing care. Her life reminds us on how an individual can shape an entire profession through dedication and vision.
Every nursing theorist has their own concepts or models, and the Newman system model was introduced in the mid 1970s by Betty Newman herself, and it is considered a grand nursing theory that provides a comprehensive framework that guides nurses and caregivers in helping clients manage stresses actively. According to the Newman System Model Trustees Group, in 2011, the model serves as a tool for identifying appropriate nursing interventions in situations where the client is facing actual or potential stress. The model illustrates the client-client system, which can be an individual, a family, or even a community. It emphasizes nursing as a discipline focused on preventing or reducing stress impact and supporting the client's ability to maintain or regain stability. As you can see, if you look at this diagram, this is the model, the Newman's system model, which emphasizes a lot on human stress and how do they manage it. And you can see that there is a flexible line of defense, normal line of defense, lines of resistance. These are the core components of the Newman system model. The first one is the client concept. This concept or this core emphasizes the individual or a group whose health is being assessed and managed. The second core component of this model is the environment component, all internal and external factors that influence the client system. The third one is stresses, which means there is the internal or external forces that can disrupt the client's system stability. And last but not least, health component. It is a continuum ranging from optimal wellness to illness that influenced by the system's ability to adapt to stresses.
In Betty Newman's system models, the lines of defense and resistance are crucial concepts representing the body's and mind's protective mechanisms against stresses that can disrupt the health and the stability of the patients. The first line is the flexible line of defense. This line is the outermost boundary that acts as a buffer to protect the normal line of defense from stresses. This line also influenced by variables like sleep, nutrition, stress level, and immune function. An example situation is such as a well-rested nurse with a strong support system and healthy coping mechanisms may resist stress from a high pressure shift because their first line of defense, which is the flexible line of defense, is strong. If the nurse is fatigued and emotionally drained, then this line will get weakened and making them more vulnerable to stress-related illness. And next is the normal line of defense. This line represents the patient's usual level of wellness or stability that has achieved over time. and this reflects the person's usual health patterns and coping mechanisms. For instance, a patient's regular blood pressure is 120 over 80 is part of their normal line of defense. So if stress causes the blood pressure to rise to 150 to over 100, so this may indicate that the normal line has been penetrated. And lastly, line of resistance, which is the internal mechanism that attempt to stabilize the patient's or the client system and foster recovery after a stressor has penetrated the normal line. This may involve immune responses, psychological coping mechanism, or social support. For example, a diabetic patient develops an infection, and then the immune system, which is the line of resistance, is activated to fight the infection. Therefore, if the immune response is effective, then the patient recovers and returns to state of stable. In Betty Newman's system model, there is a concept that is called prevention as intervention, which is guides nursing actions and it focuses on preventing stresses from disrupting the client system and aims to maintain or restore optimal system stability. There are three levels of prevention. First is the primary prevention. This prevention protect the normal line of defense and strengthen the flexible line of defense before a stressor invades. And this type of prevention focus more on health promotion and disease prevention. For example, a nurse provides flu vaccinations and stress management education to elderly patients at a community center. This helps prevent illness and maintain their baseline health. And secondly, the secondary prevention. This type of prevention identify and treat symptoms after the system has reacted to a stressor. This type of prevention focus on early diagnosis, from intervention and symptom reduction. For instance, a school nurse screens students for anxiety after a natural disaster. Those showing signs are referred for counseling before symptoms got worsened. And lastly, the tertiary prevention. This type of prevention support the system recovery and prevent further deterioration after a health crisis. And this type of prevention focus more on rehabilitation and return to its stability. Example situation is a nurse helps a stroke patient with physical therapy and lifestyle coaching to restore function and prevent another stroke.
Now let us move on to the next slide, which is metaparadigm. So, metaparadigm, also called as the dominant paradigms, provides the broad framework that defines the boundaries and focus on a scientific discipline. In nursing, the metaparadigm serves as a guide to understand the core aspects of the professions, especially in nursing. So, according to Fawcett 1978, there are four essential concepts in nursing's metaparadigm: person, environment, health, and nursing. If you can see in the poster on the slide, yes. So, the person refers to the individual, family, or the community receiving care. The environment includes all internal and external factors that affects the person's well-being. Health represents the degree of wellness or illness experienced by the person. Finally, nursing is the action or process through which nurses provide care and promote health. So, all of these concepts help nurses can focusing their scientific efforts and provide holistic care to the patients.
Alright, according to Betty Newman's nursing theory, a person in meta-paradigm concept is viewed as a client, as an individual, a group. A group, it could be a family members or a group of communities in that particular area. So any problem within the client system itself that comes from surrounding, which is stressor, he or she has those variables as the third, those five. Okay, so given a situation when we encounter a hot thing, a hot kettle, for example, and these five variables work together within the client system itself. So first, how The first is physiological. How does our body respond to hot thing, and how does homeostasis processes in this situation work and react within ourselves? Okay. So second is psychological, is how our cognitive processes work in the brain, thinking of many ways to deal with a problem, with that problem, okay, such as treating our burn finger or that affected area. Third is social cultural, is how we use our daily routines, or maybe there are remedies that we usually use or apply to any situation, any this kind of situation. The norms that compliances with cultures, such as use old and traditional ways that pass down to us from ancestors to heal the affected area. Fourth is developmental, is how the client system uses a maturity on themselves and how to deal with the problem, okay, whether it is independent or dependent. Okay, independent means you are dealing it by yourself, you do not need to get help from other people. Dependent means you are depending on other, you are calling out the person nearby to you and get help from them. Last but not least is the spiritual. How does the actually spiritual work together with psychological? For example, the brain needs to calm down ourselves, and spiritual work as we are feeling grateful of not affecting other parts of the body. Yeah. So these five variables stated here are essential to are essential for survival factors that protect the person against adverse events or outputs whenever.
The next one is environment. In Betty Newman's model, the environment is divided into three key domains. The first one is internal, external, and created. The first one is internal environment that exists within the client and includes the personal elements such as self-concept, expectation, and perceptions. These factors shape how the client understands and responds to stress. The next one is the external environment. It refers to the influence outside the client, such as the interactions with other people, cultural norms, and social conditions. These external factors can either support or challenge the client's sense of stability. Lastly, the created environment is unique, self-developed space formed by the client. It consists of personal choices and protective behaviors that help maintain internal balance. This created environment acts as a buffer that supports the client's overall well-being.
According to Nueman 1995, nursing is a unique profession focused on assisting clients, whether individuals, families, or communities, to maintain or regain the optimal wellness and deal with the actual or potential stressors. According to Jacob et al. 2023, the nurse's role in the Nueman system model is defined by the systematic use of three levels of intervention, such as the primary, secondary, and tertiary, to manage current or potential stresses within the client system. This flow of interventions directly influence the patient's response on how they react and adapt to the stresses. The ultimate objective is to use these nursing strategies to promote the patient's overall well-being. Let's take a look at how the nursing role is structured within the Nueman Systems model. The surrounding hexagon emphasizes key outcomes of effective nursing care, such as health, wellness, stability, harmony, and balance. In this diagram, you can see that the client is represented at the center of a system surrounded by multiple lines of protection. These are the lines of defense and resistance that nurses work to support through preventive interventions. Starting from the outermost ring, we have the flexible line of defense, which is associated with primary prevention. Here, the nurse's role is to identify and reduce the potential stresses, which may be intrapersonal, like emotions or thoughts, interpersonal, such as conflicts with others, or extrapersonal, like work stress or financial burdens. Strengthening this line helps prevent stressors from penetrating the system into the second line of defense. Moving inward, we find the normal line of defense linked with secondary prevention. This is the client's usual state of health. At this stage, the nurse acts quickly to carry out interventions to reduce the negative impact of the stressor, such as early detection and treatment. Closest to the core, we have the line of resistance related to the tertiary prevention. These lines activate when stressor has broken through both outer defense. The nurse's goal at this point is to restore wellness, promote recovery, and help the client return back to balance. According to Lowy and Elwood, health is not regarded as a fixed state, rather, is defined by the optimal equilibrium and stability of a system, existing on a continuum that extends from wellness to illness. Example with this weightlifter illustration, on the left, when the energy available is less than the required to maintain system stability, the more the individual leans toward illness. However, when the energy required is more than the energy needed to maintain balance, the closer it is to wellness. So, the goal in nursing care is to promote conditions that require the least amount of energy to maintain health and system stability.
This is the case scenario. So, Mrs. Lina, 52 years old, is a high school teacher and lives with her husband and two teenage children. One day, she visits the community health clinic for a routine checkup. Her blood pressure is 160 over 100, and she reports feeling overwhelmed due to her workload and family responsibilities. She has not been consistent with her medication and often forgets to take it. She also complains of poor dietary habits, limited physical activity, and growing anxiety.
Looking into nursing process, in the Nueman system model, holistic assessment is the first thing we need to carry out. We have collect data according to Nueman system model 5 variables. So the first variable would be physiological. Mrs. Lina has a high blood pressure reading of 160 over 100 mmHg with poor compliance to medications. She also has poor dietary habits and limited physical activity. Going into psychological aspect, Mrs. Lina expressed her feeling of overwhelm and anxiety. And the third aspect would be social cultural. Mrs. Lina lives with her husband and two teenage children. She is also a high school teacher. Going into the fourth aspect, developmental, Mrs. Lina is currently in her middle adulthood stage. And lastly is the spiritual aspect. However, we have no data of Mrs. Lina's spiritual. Next, we have to identify the environmental stresses, which are interpersonal, intrapersonal, and extrapersonal stresses. The intrapersonal stressors originate from within the client's own system. This can be physiological, emotional, or cognitive imbalance. For Mrs. Lina, the key intrapersonal stressors include elevated blood pressure 160 over 100 mmHg, which is a physiological red flag, poor dietary habits and lack of physical activity, which weaken her physiological line of defense, and her persistent anxiety and feeling overwhelmed, which is psychological stresses impacting emotional coping capability. These stressors directly disrupt her internal balance and make her more susceptible to illness. Going into interpersonal stresses, according to Nueman system model, this external relational pressure can penetrate the normal lines of defense if not managed effectively. These are stresses that arise from her relationships and interactions with others. Mrs. Lina is a wife and a mother of her family. While she has family support, the role expectation and responsibilities she carries as a wife and mother are major interpersonal stresses. She likely feels the pressure to manage the household while maintaining professional responsibilities. There may be communication gaps or emotional disconnect within the family, which may leave her feeling unsupported. Moving on to extrapersonal stresses, which are external but indirect, are external factors that are more distant from the client but still have a significant effect. They are usually environmental, occupational, or systemic. For Mrs. Lina, her high workload and responsibilities as a high school teacher may lead her to chronic stress and reduced self-care. Her busy schedule has limited her access to structured wellness programs or professional counseling. These stresses often contribute to or magnify both interpersonal and intrapersonal challenge. Based on the assessment, we have identified 4 actual nursing diagnoses and 2 potential nursing diagnoses for Mrs. Lina. So for the actual nursing diagnosis, the first one would be ineffective health maintenance related to non-adherence to antihypertensive medications. Second, imbalanced nutrition related to poor dietary habit. The third one, ineffective mental coping mechanism related to role overload and anxiety. And the last one would be sedentary lifestyle related to lack of time and motivation. So for the potential nursing diagnosis, there is 2. One is a stroke due to uncontrolled blood pressure, and the second one is depression associated with chronic stress and anxiety.
The nursing interventions stated here are designed with nursing in meta-paradigm concept based on Betty Newman's nursing theory. So the first nursing diagnosis is ineffective health maintenance related to non-adherence to an antihypertensive medication. The one of the interventions is educating Mrs. Lina about the importance of antihypertension medications. This is to let Mrs. Lina know how actually those medications work to elevate down abnormal vital signs. Okay. Also, advise Mrs. Lina to use a reminder medication reminder application. One of it, the most common application that can use to remind her is Google Calendar. She can set up the time in that and also type out what are the medications, how many dose of medication prescribed by the doctor that she must take in. And the last one is encourage the family members of Mrs. Lina to help her out. This is just to the family members can work as supporters to remind her again about the intake of medication. Second symptoms is imbalanced nutrition related to poor dietary habit. The intervention is educating what are foods or drink that give out benefits to Mrs. Lina body. This one we can set the examples. Mrs. Lina can set the examples of food and drinks that she can take through food chain, the pyramid food chain. Those are the list food or the levels food or how much food of that category can be taken up. Also can encourage Mrs. Lina to refer to pyramid food chain like I said just now. And the also provide a proper meal planning for her daily intake. Maybe the family member can help her or she independently works on planning the meal for her daily intake. And also remind Mrs. Lina to read food labels whenever she goes for groceries. It is nice to advise her or to remind her to look at the labels of food, the food labels, to know the exactly calories and the pros and cons of getting a kind of food sold in the store.
And now I would like to talk about the nursing interventions for the potential nursing diagnosis. First, stroke due to uncontrolled blood pressure. The nursing intervention that we could do is to administer antihypertensive medication as prescribed, educate patient on low sodium diet, encourage regular physical activity according to patient's ability, teach patient the stress management relaxation technique, example deep breathing exercise, and lastly, ensure routine clinic follow-up with blood pressure monitoring. And for the nursing diagnosis potential of having depression associated with chronic stress and anxiety, we could establish trusty nurse-patient relationship, encourage patient to express feeling, encourage participation in stress relief activity, example yoga, encourage social support from family and friends, refer to mental health professional whenever necessary, and lastly, provide health education on signs of depression and when to seek for help. In the final step of the nursing process, we move into the evaluation phase, where we determine whether the interventions have helped restore or maintain Mrs. Lina's system stability. First, we monitor her blood pressure charting regularly to assess the effectiveness of the interventions and whether her readings are moving toward a stable range. Second, we evaluate her compliance with antihypertensive medication, looking at whether she is taking her medications as prescribed and if reminders or family involvement have improved her adherence. Third, we assess Mrs. Lina's ability to cope with stress, focusing on emotional and psychological responses. This includes observing her anxiety levels, sleep patterns, and her use of coping strategies like deep breathing and communication. Lastly, we evaluate her engagement in physical activity and dietary changes. This means reviewing whether she has implemented regular exercise and healthier eating habits as previously planned. Through this holistic evaluation, we ensure that our nursing interventions are not only reducing stresses, but are also helping reinforce Mrs. Lina's adaptive ability, aiming for long term system stability and wellness.
In conclusion, Betty Newman's systems model offers a comprehensive and holistic approach to nursing by viewing patients as a dynamic system influenced by psychological, sociological, social-cultural, developmental, and spiritual factors. The model emphasizes identifying and managing stressors through primary, secondary, and tertiary practice prevention strategy. The application of Newman systems model in practice, as demonstrated in the case scenario of Mr. Lina, highlights its effectiveness in guiding nursing interventions. By identifying treasures, recognizing potential resources, and implementing primary, secondary, and tertiary prevention strategies, nurses can tailor care to meet individual needs and promote optimal health outcomes.